The job takes place in a nursing department at a long-term care facility. Because the recent outbreak and pandemic of the coronavirus puts elderly at great risk, there must be a change in performance standards of the staff. This is to control and prevent the virus and any other infection from putting the patients and elders living there at risk and spreading within the facility. The employees in this situation include some of the nurses and physicians coming in contact with various elders and patients on a daily basis. They all must be made aware of the new protocols to prevent risk of spreading the virus if any cases are to come up if the pandemic worsens in the outside environment. Their performance standards are not only being looked upon to allow them to stand out as an employee, but to enable everyone to work as a team in the exact same ways to provide quality of care to patients and adapt to a current health issue that puts our population of patients at a high risk. Hello, fellow nurses and physicians. Thank you for being here today to discuss this matter. I will not be keeping you too long, but I would like to go through our new protocols to take action to the new and unexpected outbreak of COVID-19 throughout the U.S. As you all know, this clearly has a direct impact on our patients, and we must do everything we can to show them that we are taking all possible precautions.
When will they be put into effect? For how long?
Well, the changes are minor and not difficult to follow. Unfortunately, they are being put into place as soon as possible and until further notice depending on national standards. However, there are many little changes that are going to be made. It is crucial that everyone following these guidelines it is important that we enforce them at all times due to the level of severity of the outbreak and how our population is at risk. Unfortunately, anyone who is unable to follow these new requirements will be sent home immediately. I do not want to sound harsh, but this is for the best regarding our patients and our business in general. Therefore, I'm going to list all of the new standards for now. I ask for your full attention, and I am more than happy to answer any questions.
We are happy to do whatever is expected to us.
Thank you. I am now going to go through a list of standards that are crucial that we start immediately and follow at all times. Some of the resources needed include latex gloves, masks, extra hand sanitizer dispensers in each department and outside each room, paper and disposable covers for everything in each patient room and throughout the entire organization. Necessary skills include hand washing before and after contact with every patient, as well as limiting contact. Providers must also clean up all equipment used, especially those that come in direct contact with patients. We will also be allowing no visitors for the next 2 weeks, and we will then make a decision whether we should extend this procedure depending on national standards. Anyone who walks into the facility will be required to answer a questionnaire regarding possible flu symptoms or recent travel out of the country. Even small tools such as pens, buttons on printers, keyboards on computers, etc. are to be wiped down with Clorox wipes after use. If any patient is to be tested positive of COVID-19, they will be quarantined within the facility or transported to the hospital depending on what would be best for the patient as well as others. We will work extra hard as an organization to make sure there is minimal to no spread of germs whatsoever throughout the entire building. Employees are also to sign a waiver that when off duty they are limiting their contact with others and possible spread of germs while not in the facility. We want to reduce the risk of providers contracting the infection and then bringing the risk to others to work within the next few weeks and in the future and in general. Are there any questions regarding any of the statements I just made?
Should we be using gloves at all times?
Yes, if need be. You must wash your hands or use a hand sanitizer dispenser before and after taking gloves off. This should take place at all times. Any equipment you touch without gloves, such as pens or computers, will be wiped down with Clorox wipes before anyone else uses them. And you must disinfect your hands before and after using. Utilize a new pair of gloves. Does that help?
Yes.
Great. Any other concerns?
Just to be clear, there are no outside visitors. What about vendors?
No visitors at all until further notice. Any other people entering must answer our questionnaire and then continue the work they must do while also following our protocols of washing hands and minimal spread of germs. I will try to monitor people who come in and out as much as possible. If anyone is to answer yes to any of the questions in the questionnaire, unfortunately I will have to escort them immediately.
Can you go further into detail of how we should prevent contraction and spread of the virus while off duty?
I would like everyone to try to only be in public places when absolutely necessary for the next 2 weeks. Try to keep 6 feet of distance between yourself and others at all times. And while you are at home with your families, try to use similar protocols to what I mentioned for your shifts here as well. Keep cleanliness in mind. I can't stress enough. If you are not feeling well in any way or feel as though you have some kind of infection or germs that you might be bringing into work with you, please do not come into work. We need to keep our patients in mind as they are our top priority. Spreading infections throughout the facility will only make matters worse for them as well as our staff. Does all of this make sense? Do I need to go over any more concerns? Okay, well, we need to get the ball rolling with our new guidelines as soon as possible, so please start practicing these strategies. If any questions come up at all, do not be afraid to ask. Everyone is expected of the same thing, so I would like to see consistency among all of you going forward. I wish I could have a better time frame for this, but fortunately, these are good habits to get into anyway. I appreciate all of your cooperation and understanding. Thank you again. Stay safe, everyone.